So hi, I'm Dr. Srinivas from the Department of Cardiology, Vydehi Super Specialty Hospital. See, earlier there used to be increased incidence of heart attacks with age. So early 60 years for males and 70 years for females used to be the age where we used to see attacks. Now the present situation is different. The incidence of heart attacks are rising at a rate of 2% per 1000 or 1500 in younger people of less than 40 years of age. See, it's a very interesting topic. The pain is common whether it is young or adult or old or elderly, and the pain is the same. The typical pain of a chest pain of a heart attack is that they have a central retrosternal chest pain, severe excruciating pain coming on suddenly and lasting for more than half an hour, and associated with sweating. They have severe amount of anxiety, restlessness and breathlessness. This is the anybody having these symptoms should consider that it is heart attack. Yes, heart attacks are deadly in young people because they have very little time to get support, because the elderly people, they have chest pain and they come to the doctors and they have collaterals for them to support the area which is at risk. Whereas young people, it is fresh and one artery closes, there is no support for that area from other arteries. So there it is a deadly, and the majority of them have they die at that particular time. See, that's a myth that anybody dying of cardiac illness is not heart attacks. It can be due to some other conditions like familial hypertrophic cardiomyopathy or familial arrhythmias or familial autonomic disorders, and which can also be the reason for sudden cardiac deaths in young people. So heart attack is one of the reasons for sudden cardiac deaths. Yes, it is a very pertinent subject for the young people because of the present day stresses. Anywhere, right? Stress is there right from studies to the working atmosphere, and in the working place also there is a lot of stress, plus the personal stress. All those things, stress, have got a physiological disturbance, alter the physiological milieu of the body by altering the flow of the circulation, and they get into hypercoagulable state, and heart attacks are common because of the stress. Young people have to first identify themselves that there is a risk, that is in the form of the various risk factors like hypertension, diabetes, obesity, inactivity, physical inactivity, and eating all sorts of junk foods, and heredity, genetics. All those things are the reasons for heart attacks in young people, and if you know the risk factors, try to go behind them and we can control the heart attacks. Why does heart attacks happen in young? Because of these risk factors are present right from the age. See, like start smoking, the young people start smoking at the age of 15 years. Their risk of heart attacks doubles up at the age of 40 years. So smoking have to be avoided, the physical inactivity have to be reduced, eating junk foods have to be avoided, and if they have hypertension, the diabetes and obesity should be taken care. Then we can avoid heart attacks in young people. So that is one of the common reasons for heart attacks in young people is the smoking and vaping. Vaping is inhaling and exhaling through the artificial means by electrical devices. That is called vaping, and they say that it is less injurious to the body, but it does contain nicotine, and this nicotine and other toxic substances which are inhaled through the cigarettes and vaping, that is hookah and all, can also be injurious to the heart, and that's the reason they have to be avoided in young people.